Today, we are going to look at a body viz brain builder about fetal development and meconium aspiration. A fetus is a developing human from the 9th week of gestation up until birth. In this 30-week period of time, the immature structures from the embryonic period become fully developed through cell growth and differentiation. Let's learn about what happens during these 30 weeks. During weeks 9 to 12, the fetus is rapidly growing. Some of the noticeable changes that occur include anatomical sexual differentiation, where the bipotential gonads of the male become the testes and epididymis, and the bipotential gonads of the female become the ovaries. Fetal movements can be felt by the mother and are jerky and frequent during this time. The liver begins to secrete bile. Amniotic fluid is circulated by the fetus, swallowing it and producing urine. The eyes are well developed and the eyelids are fused closed. Nails begin to develop on the fingers and toes. Next, during weeks 13 to 16, development continues. Let's learn about a few of the developments that occur in this time frame. The eyes move closer together and the eyelids still remain fused shut. The lips start to show sucking motions. The head and ears take on more detailed form as hair begins to grow on the scalp. The urinary and gastrointestinal systems continue to mature. The intestines form meconium, which is fetal feces consisting of ingested amniotic fluid, cellular debris, mucus, and bile. During weeks 16 to 20, the fetus reaches the halfway point of a typical pregnancy. Highlighted next are a few of the developmental changes that occur during this time period. The fetus grows and movements of the fetus become stronger, causing the expecting mother to notice them more easily. The fetus's sebaceous glands coat the skin with protective and a waxy substance called vernix caseosa that will moisturize and protect the skin and act as a lubricant during childbirth. During weeks 21 to 30, further development and maturation continue as the fetus grows noticeably in weight during weeks 21 to 30. Listed here are a few of the other noticeable developments. The fetus experiences rapid weight gain, which will play one of the crucial roles in the regulation of the body temperature outside of the womb. The spinal cord of the fetus has been developing through this entire embryonic time, but during these weeks, myelination of the axons of the nerve cells begins. Eyelashes grow and eyelids are no longer fused shut. The lungs are developing and producing surfactant, which is a substance that reduces surface tension in the lungs. During weeks 31, leading up to birth, many important final stages of development of the fetus occur. Here are a few. The fetus continues to add fat. The skin goes from red and wrinkly to soft and pink. Typically, fetuses do not pass any meconium until after birth. But in about 5 to 10% of births, the fetus passes meconium while still in the womb, which can cause some major complications. Next, we will look at the symptoms, causes, and treatments for meconium aspiration, and finally, give a patient example. Meconium aspiration is when a fetus breathes a mixture of meconium and amniotic fluid into the lungs, while either within the womb and/or during delivery. Symptoms for meconium aspiration include green or yellow-stained amniotic fluid when the amniotic sac breaks. This is usually the first indication of meconium, as normally amniotic fluid is clear and watery in color. The other symptoms are recognized after birth and include bluish skin coloring, breathing problems, and limpness or weak movements of the newborn baby. The cause of meconium aspiration is when the baby is close to term or past term and has their first bowel movement inside of the womb. If it is taking a long time to deliver the newborn, the fetus may take its first breath before or during birth and inhale meconium. Treatments for meconium aspiration include immediate suction of the mouth after delivery, antibiotics to treat any possible infection, a continuous positive airway pressure machine, more commonly termed as a CPAP, may be used to provide continuous airflow into the baby's airway and keep the lungs inflated, an incubator to help maintain the body temperature, and finally, tapping on the chest of the newborn to loosen any possible secretions. Typically, the outlook for babies with meconium aspiration is excellent, but in some severe cases, breathing problems may occur. Finally, let's take a look at a patient example. You're an obstetrician on call for the obstetrics unit when a nurse informs you that a soon-to-be mother is on her way in and her amniotic sac has already broken. The mother reported that her amniotic fluid was greenish in color. This means that the newborn has already had their first bowel movement. When the soon-to-be mom arrives, a nurse checks her vital signs and listens to her belly for any other signs of distress happening with the fetus. No other signs of distress are found. The mother's contractions begin, and your priority is trying to deliver the baby quickly to lower the chances of the newborn taking its first breath and inhaling meconium. The baby is delivered 6 hours later and is slightly blue in color and taking short, quick breaths. Once the baby is delivered, you immediately suction the baby's mouth, tap on their chest, and listen with your stethoscope for any sign of airway obstruction. The newborn starts to breathe normally and becomes pink in color. The airway is restored, and you prescribe antibiotics in case there is any chance of infection. This is a classic example of meconium aspiration. For more 3D anatomy and patient case examples, like this video and subscribe to our channel.